everybody, Dr. Anjana Barnea, and welcome back to my YouTube channel. And we have the beautiful Bev with us today, and we are going to be doing her second hand filler treatment. Sometimes you might need more than one treatment, and you know, your hands take more filler than you might anticipate. So we're actually going to, like the last time we just did the top of the hand here with a cannula, we're going to do that again, and I might actually also inject a little bit of this area. You have to be super careful and go super slowly. But yeah, this also gets crinkly. Our knuckles also get crinkly, and patients do ask about that. Is there something we can do about that? Other treatments that you can also do for your hands would include peels, microneedling, PRP, profiler, all these biostimulators that are on the market, which I'm going to do a video on. It's quite an extensive video, but that's not for today. So anything you can do on your face, you can do on your hands. And it's also important to keep them protected, like wear gloves when you drive, wear gloves when you wash the dishes. A cool tip is, if you're washing the dishes, get those big rubber gloves, moisturize, and all the warm water will help push the moisturizer, like give it like that warm, like squishy feeling. Or you can even we've got like these little peel pads that we have for patients, or you can, while you're washing the dishes, have like a peel pad. Put your gloves on, and then you get like an instant peel. And then you're probably wondering, yes, I did do this to Bev. I did enlarge her lips, but it's not with filler. So I don't do like Russian lip technique, and I didn't make Bev look like this on purpose. So tomorrow Bev's lips will go straight back to normal. We did a lip neutralization technique, which is a blush sort of tattoo technique, infusing a warm color to neutralize the purplish tone of the lip, because she wants like a more even tone lip, a little bit of a pinker lip. So that's why her lips are a bit swollen. And it'll settle down by tomorrow. So we're going to start your hands. Bev, are you excited?
Yes.
So Bev's been getting numb. She's wearing gloves, and she's been getting numb for the last, say, over 30 minutes. And yeah, we're going to start now. So I am just disinfecting Bev's hand. Really cute hands, Bev. So yes, you can pitch so it has improved, but I mean, there is still a bit of laxity here. And as we age, I mean, we drive, we wash the dishes, our hands are constantly moving. So yes, it does take some wear and tear, and we have to not forget them, because our faces will look glorious, and then we have our hands that give away what age we are, what's happening. So yeah, don't forget your hands. And it doesn't always have to be filler, but yeah, start taking care of them. So usually I start from here, or even a little bit, because there's sometimes lines along the wrist, but we've done that previously for Bev. I just want to get this area a little bit, and yeah, but geez, it's looking good, Bev. So I'm going to start here. And then I'm looking at where the veins are. You know, the hands are very vascular, so bruising is a possibility, but if we can avoid it, we should avoid it. Making a little entry point for my cannula. And then I always keep an alcohol swab with me. Alcohol or anything with HOCl. Yeah, so we're just pushing the filler in. There we go. So even if it's worth a cannula, it's important to go slowly with your injection. The more slowly you go, the less trauma, less swelling, and less chance of any sort of vascular event. So often, yeah, when we first do the hands, we miss the area, like right at the top. You know, people concentrate on this. So that's what I'm doing today. I'd say when you're doing hand filler, in terms of amount of filler you need, maybe 1.5 per a hand, and then the biostimulators are a little bit different. There's one called, I'll say the name, it's called Radius, it's calcium hydroxyapatite. You might need 1 box of that, and it can be also dilute. Are you okay, babe?
100%.
It's not sore.
No, like there's such an, it's not so.
Yeah.
It's just that when you
Push it is a bit of a, like a sting. Okay.
yeah.
Okay. Yeah, it's just me injecting this then. So. But yes, so if you're on a budget, you can of course split this treatment like I've been doing here, where we've done a treatment previously and now we're just following up with some more filler. So there, let's check your little knuckles out. So I pinch, and just very little, so it's a very, so not to overfill the area. And then there's a lot of laxity, a lot of loss of volume, as you can see. You okay there, babe? Stinging like me. Sorry. But as soon as it's done, there's nothing, hey? As soon as it's injected,
Yes.
yeah. Let's have a look. Okay, there's this here. So yeah, just to be slow and careful. Okay, so post-treatment, there's this phytocorrective gel that I'm going to use. It's pretty cold. Sorry, babe. And today, it doesn't look like it, but it's a very cold day in Joburg. It's like 10 degrees Celsius out there. But it's nice to have something cooling and calming to massage with. So there we go. So I'm just massaging the filler. And this is a nice leave-on mask. After a biostimulator filler of the hands, I usually put gloves on for the patient so they can sit on their hands, so that's further massage, and it protects your hands while you're driving home, or if you really need to do something with your hands, like go home, and I don't know if you'd really like to cook and wash the dishes, but I can write you a note to give you the time off for that.
Please.
So, yeah. And usually when we do faces, I would say to the patient not to massage because we mold and we sculpt the face. But if you'd like to, Bev, you are welcome to, with this firm pressure, massage it. And if you use a biostimulator, it is actually very nice to massage the hand. So traditional biostimulators, I'm talking polylactic acid Sculptra. There's a new one, Harmonica, Radius. Yeah, there's new ones all the time. So, but those are the 3 big guys for now. Here we go. So this hyaluronic acid will absorb 1,000 times its own weight in water and plump out because it's already improved texture, it improves skin tone, and then what it does is wakes up your fibroblasts. So it stretches the dermis, the second layer of skin. So it doesn't stretch your skin and it gets all saggy. It stretches the fibroblast, wakes it up, like almost makes it do like fibroblast Pilates, and then the sleepy fibroblast then starts to make new collagen, elastin, and hyaluronic acid. There we go. So Thanks for joining us, guys. As you see, we've done Beverly's right hand. I'm going to continue doing her left hand after we close up. But just to show you what we've done, so you know, it is important sometimes to do a follow-up treatment. I've had my hands filled and I was very happy with it. It was with a filler that actually has glutathione in it, and but you can see, so we did like a secondary treatment, but with mine there's like, my palm is really nice and soft and smooth, and then my knuckles need a bit of extra help, so we'll do a secondary treatment on that. But thank you, Bev, for joining me. And if you guys have any questions, drop them down in the comments below. Like, share and subscribe. Bye, guys.